Today, we're here to talk about influenza and an update on influenza, some of the new options that are available for the Canadian market. So, I thought before we delve into our content, I do a little bit of an introduction and some of housekeeping for myself as well. So, a couple disclosures about myself is I did want to mention the number of commercial interests that I have participated with, both as an advisor as well as a speaker. And as Dom mentioned, a little bit of my past employment. I do currently work for Manulife Financial and the University of Waterloo, but in the past I have worked for Shoppers Drug Mart, Rexall, McKesson, as well as the banking industry. And also to let you know that I have received a speaker's fee from the OPA for this learning activity. So with that, I do notice my video is a little choppy, so I'm going to try to save bandwidth and stop the video, but let's move forward with our presentation. So in today's presentation, we're hoping that the learning objectives that you take out of this course are to understand the burden of influenza, identify the differences in influenza vaccines, so we'll go through each one of those, determine the role and benefits of recombinant influenza vaccines, as well as recognize and integrate influenza care into your pharmacy workflow. And we'll talk about some of the challenges that you might be facing in your pharmacy and what you can do to help better integrate this into your day-to-day workflow. So let's start off by looking at influenza. It's the flu, and I know we're talking about this in what's almost July, but it's never too early to start talking about the flu. I know in some places we start looking at flu planning back in April. So it's kind of timely that we mention this. So as we start talking about the topic, I thought I'd give everyone a bit of a background information, just a base to start off with. Influenza, it's a contagious respiratory illness. We know that it's caused by the influenza virus, and it specifically infects the nose, the throat, and the lungs. Most people who are impacted by this tend to be those who are older or younger children that have more complications, but it's certainly something that can impact just about anyone as the season comes into play. It's most contagious when your symptoms are prevalent. So if you are sneezing or coughing, that's when the virus is more readily spread from a person to person. And it's often spread either through people touching doorknobs, phones, remotes, cross-contamination that can allow the virus to spread to another individual. Influenza, or the flu, is traditionally two types of constantly mutating viruses. So you've got influenza A and you've got influenza B. The virus basically mutates fairly rapidly and quickly, and that's why you'll often hear each season the influenza vaccine is based upon the last season's or southern hemisphere mutation that they viewed, and they try to predict what that mutation is to make sure that the vaccine is the most effective for individuals for that season. The most common symptoms, as some have already mentioned, are a sore throat, coughing, runny nose. It can lead to tremendous body fatigue, chills, as well as body aches and a headache as well. So this is usually what most individuals experience when they're having a bout of the flu, which a lot of us can see may sound very similar to what other conditions may have expose themselves as symptoms. So you may be looking at it's similar to COVID symptoms, similar to, in some cases, allergies. So it's important as healthcare providers, we play that role in recognizing the flu is something that does occur within a certain season and that you protect yourself before it occurs, because there's a lot of differential diagnosis that can occur there. And with that, it kind of makes sense to talk about the flu and the burden that it consistently presents to us. We know that the flu season runs from about November to about March. And what's interesting is that influenza isn't often thought of a cause for death. But as you can see on the screen here, in a survey and study that was done in 2019, we saw that influenza and pneumonia landed within the top 10 leading causes of death in the Canadian landscape. So that's quite significant. Similarly, you can see that each year in Canada, there's an estimated assumption that influenza causes about 12,000 hospitalizations and 3,500 deaths. So that's a lot if you take it into consideration, depending on what our population is at the time. So protecting yourself against something like the flu may seem like it's not that important. The symptoms seem like there's something that a patient can overcome, but can result in a huge proactive benefit to yourself, and the fact that it does have severe complications for certain individuals. So on that, Almost most Canadians do not perceive influenza to be a severe threat, and it often is seen as being a light or mild symptom that they experience. It is something that can be hazardous specifically to children as well as adults age 65 and older. And so that's why there is a strong recommendation that Canadians get vaccinated against this, especially Canadians who happen to be older and Canadians who are healthcare providers. But survey studies in 2017 don't necessarily indicate that most people are taking this recommendation seriously. About only 40% of Canadians aged 18 years and older get vaccinated, and 70% of individuals who are of the older population get vaccinated, that's 65 and plus, and approximately only 50% of healthcare workers are vaccinated against influenza. So it really shows that there is a role for pharmacists to play in bringing awareness to this. We're readily accessible. We knew how much we've done for the COVID-19 vaccine. We know we have a strong workflow, but now it's helping those patients understand what risk they're at and why it's so important that they should protect themselves. It's also something that we can take to whether are some of our partners. So if we do happen to work with specific employers that are next to us, or we're part of a preferred provider network, influenza has a serious economic impact for those individuals as well. It has an impact on productivity for employers from an absenteeism and presenteeism perspective. It's estimated that approximately 1.5 million hours of work are lost every year due to influenza. So it's something that a lot of employers may want to take heed of, especially with today's kind of staffing concerns that are available. We also know that with the respiratory infection, it has the second highest indirect cost to the Canadian healthcare system, totaling about $2.8 billion in spend in a 2008 review. So there is a lot of financial cost to this, as well as health outcomes cost to this, that our partners as well as our patients should really be aware of. With that, we'll kind of move on to the area that talks about why vaccines are effective. We know that we should have vaccines at this point. We've talked about the burden of the disease and the impact of the disease, but why are vaccines effective? It might be something that you've dealt with in practice where patients have come in to inquire, well, is this really going to protect me? Well, it's important that we understand that influenza vaccines do have a robust amount of experience to protect an individual, but they're not 100%. So the capacity of the virus to mutate and the fact that it has a diversity of impacts on what causes it to mutate can impact the efficacy of the vaccine. So each year when the vaccine is created, the WHO makes a strain selection that they believe to be the most prevalent circulating vaccine. We understand that the vaccine, irregards to the strain that's selected, may have some variance in its efficacy based on the individual themselves. So depending on the person's age, their gender or sex, and their underlying medical conditions, vaccines work differently for them. We also know that there are variable degrees of transmission from influenza virus each season. So depending on how the season goes, some seasons it's more contagious, it's more readily available to mutate and move to another host. Other seasons it's not so. We also know that mutation occurs during the season as well. So mutation occurs due to the hemagglutinin, which is an antigenic structure within the virus in the cell, which really is one of the key components that drives how that virus enters the body. So with all these different factors, there are going to be circumstances where the vaccine cannot be 100% efficacious, but there is an effectiveness to the vaccine that we should prove to our patients, highlighting to them that you're protecting yourself as well as your community and those around you by getting vaccinated. There is effectiveness to the vaccine, but setting realistic expectations that the vaccine will not be 100% effectiveness in the sense of that they won't be getting the flu if they happen to get vaccinated. So I often hear in practice a lot of patients who come into the pharmacy who say, well, last year I got the flu shot, but I still happen to have gotten the flu. Again, it's setting those realistic expectations that'll help them be adherent year over year. So understanding that the effectiveness of the flu vaccine is one consideration. The second should be that, oh, my apologies, I think I'm getting a phone call from somewhere. Let me just mute this for a second. So the second part of this is considering that the number of different vaccines that are currently available for adult immunization. Adult immunizations have a number of different choices, one being the standard dose trivalent strain. That is primarily the Fluad vaccine that you've probably seen in many of your pharmacies. That strain has about 50 micrograms per strain of the hemagglutinin antigen. And you know that that's been created through eggs. So anyone who has an egg allergy, there's a sensitivity there that they should take into consideration. This is primarily recommended for individuals who are 6 months to 2 years, and the dose for that is about 2.5 mils. 0.25 mils. And we also know that the Fluad comes with the adjuvant at 0.5 mils for individuals who are 65 years and older. We know that there's a standard dose quadrivalent vaccine, which looks at 4 strains. So the trivalent vaccine looks at 3 strains, which is specifically 2 of the influenza A virus and 1 of the influenza B, whereas the quadrivalent vaccine looks at 2 of the influenza A and 2 of the influenza B viruses. The quadrivalent vaccines, you have various different influenza vaccines that are available to you, as well. You have, again, that 50 micrograms per strain that's available. Here you do have one that is not constructed using egg-based cell therapy, so that there isn't that egg allergy concern in that specific vaccine. Both of these are recommended for individuals who are 6 months or older, and the recommended dose is about 0.5 mils, which is a standard dose. Now we have the recombinant influenza vaccine, which is also a quadrivalent vaccine. So you've got, again, the 2 strains of A as well as the 2 strains of influenza B. This is a little bit different. As you can see, the hemagglutinin here that the vaccine contains is 3 times higher than that of the previous vaccines. So because of that, you see that there is a larger ability for protection by this vaccine. Also, what's to note here is that this vaccine does not use egg cell-based therapy to be able to be constructed. So you have that concern of an egg allergy omitted here. This is an adult influenza vaccine, as it is indicated for individuals who are 18 years or older. And again, the dose is for individuals who are 18 plus at 0.5 mils. You also have the high dose influenza vaccine. We know this quite well with the older population that we see every season, which is Fluzone high dose. It does have a higher amount of hemagglutinin that's in the vaccine. It's 60 micrograms per strain, hence it is high dose, but it is recommended for individuals who are 65 years and older. And I think we know every year this is one of those vaccines that we restrict for individuals of the older population because of the need of coverage for them and the fact that that protection is so vital because of the comorbidities that individuals have. So moving forward, this is just a bit of a comparison chart to give you another glimpse of the different vaccines that are available and looking at the way that they're manufactured, as well as some of the characteristics of their products. So as we saw, egg-based manufacturing is quite prevalent, especially in the trivalent and quadrivalent vaccines. We do see that cell culture-based manufacturing is available, specifically when you're looking at the one influenza quadrivalent vaccine that was identified. And finally, we see that the recombinant manufacturing process is unique to the recombinant influenza vaccine quadrivalent, which specifically is done through insect cell culture. So it's very different than the other forms of manufacturing. And what we'll do is we'll get into that a little further to understand what makes this vaccine structure and the way that it's manufactured a little bit different. So manufacturing process for the recombinant influenza vaccine allows an exact match to what the WHO has selected as the strain that will be circulating that year. So what does this really matter? It matters in the fact that we really want the vaccination that an individual obtains to be as similar to the predicted virus that's expected to be circulating for that year. So the closer it is, the better protection you have. And the way this is manufactured is because of the hemagglutinin. It's key in the process of manufacturing. So what happens is that this specific hemagglutinin is the influenza virus's protein, and that's what allows that virus to enter into our cells. So it's almost like the key that allows it to open the gates to be able to infect an individual. So by looking at the whole virus, rather than looking at the whole virus and the specific key, the hemagglutinin, and looking at the exact genetic sequence or the DNA of that in the manufacturing process, we're trying to be as specific as possible to ensure that the vaccine creates our body's immune system to fight against the appropriate virus. So in step 2, we recognize that specific section of the genetic sequence to be able to then take that material and use it and combine it with a plasmid of the modified baculovirus DNA, which is basically making a set of instructions for the vaccine to be able to cause that recombination. So that's the form of manufacturing that occurs. And then in step 4, these instructions that are generated by the recombination are inserted into a modified insect cell rather than that egg-based cell therapy that you usually see that is read and creates hemagglutinin proteins. These proteins are then, or antigens, taken and processed to create that vaccine. So essentially what you can think of this entire process is that due to the fact that the process uses the recombinant influenza vaccine, we've kind of taken those specific components that are the key. So if you think of it as a key and a lock, you're looking at those specific grooves in the key and you've highlighted that structure and you've kind of multiplied that to generate a specific sequence that'll target our body to recognize that if someone's trying to open your door with this key, you need to create a fight response to help protect the body from getting the influenza virus for that year. So that's kind of a high level description of the manufacturing process for the influenza vaccine. The other component I did want to talk about was the fact that the universal immunization, influenza immunization program versus a non-universal influenza immunization program vaccine. So we know every year there is a set of DINs and lists that are set out of the vaccines that are covered by the Ontario provincial program. It's important to recognize that this has two distinguishing factors. As a pharmacist, we are allowed to independently initiate and administer influenza vaccines that are eligible as per the program. This does not hold true for those that are not part of the program. And as we also know, pharmacy technicians are now authorized to administer for treatment in this area as well, as long as the individual is 2 years or older. And similar for pharmacists as well. So it's important that we recognize that when we are going into our flu season, that the products that we supply to patients fall within this program. Otherwise, we need to take alternative steps to be able to provide or have patients access to that product. So now that we've talked about the virus, we've taken a look at what the burden of disease is. We understand that it's got an impact both on health outcomes as well as financial outcomes. We've taken a look at the various different vaccines that are available, as well as the fact, some of the differentiating factors of the recombinant influenza virus. How does this all really pertain to your day-to-day practice? What does this mean? So if we take a look at a case study here, let's talk about Tanya. She might be a patient that you see walk into your pharmacist. She's a regular at your pharmacy. You know that as per her profile, she's 58 years old. She currently has type 2 diabetes, so she's on metformin and she's on an insulin, a long-acting insulin. You know she's got hypothyroidism and she's on levothyroxine Synthroid to treat that. And you know that she's got high cholesterol, so she's on rosuvastatin to treat that as well. And she's walked into your pharmacy today and inquiring about getting her COVID-19 booster, as you may see some patients walk into your pharmacy and ask for. And she's also there to pick up a medication refill on her insulin and metformin. This would be an ideal time for you to start a conversation with Tanya. As we approach the flu season, some of us may not be thinking about our flu vaccines quite yet, but it is important to kind of keep in mind which patients would benefit the most from an influenza vaccination. If we take a look at Tanya, Tanya is a typical patient you might see, but some things stick out about Tanya. We know that Tanya is 58 years old, so she is older, so that places her at a larger risk. We also know that Tanya has multiple comorbidities, and that also places her at a larger risk of suffering complications from the flu. So Tanya is an ideal candidate to protect herself against the flu this season. Another component that's interesting to note is the fact that most individuals who are 50 years or older in some form or another, do have underlying comorbid conditions. So they are at a higher risk of potentially being hospitalized or even suffering from death from influenza. So these are those patients that we often see in our pharmacy, and we need to highlight. The aging Canadian population has a number of different comorbidities. I know diabetes is one of the highest ranking conditions that we see of individuals who walk into our pharmacy. And most of these individuals have multiple conditions. So if we look closely at these individuals, we want to make sure that we've offered as well as signposted them to receive their vaccinations that they need. And the flu vaccine is definitely one of those. If we look a little closer at this chart, what's interesting is you see a marked increase in the number of conditions or high risk conditions an individual has as their age progresses. And oftentimes people who are 65 plus, they have at least one of the chronic conditions listed on the right side. We see that 53.1% of them have it. And most of those individuals are pretty diligent. They're aware of their health conditions, they're older, they often recognized or are seen by healthcare providers a little bit more frequently. The group that often gets missed is that age range between 50 to 64. It's the age that's still working, that often is a caregiver. They're changing their current structure of how their day-to-day life looks. Most of them, probably 44.1% of them, have some form of comorbidity that puts them at risk for the flu, but it's not something they've often thought about. So those are those individuals who you may see pass through your pharmacy. Perhaps they're picking up something for themselves, perhaps they're picking up something for their entire family, but who should really take a look at if they would benefit from having the flu vaccine, not only for themselves, but because they may still be a caregiver and need to provide care to those around them. So that brings us to the topic of how do you initiate the conversation? I mean, if we take a look at our case study, we know Tanya is a candidate that you would want to initiate the conversation of flu vaccination with, but when or why or how do you initiate that conversation with her? It's not necessarily the role of the pharmacist to do. I mean, the pharmacist can absolutely initiate it, but the entire team can play a role in initiating this conversation. Most of the times in practice, what we do is during a refill, we often flag individuals who would be flu vaccination candidates, whether that be putting a flag in the basket, so we have that conversation with them when they're at point of sale and they're checking out, or whether we flag them in the system so the next time their refill is filled, we have that conversation that when you come in, would you like to consider having your flu vaccination, depending on what time of the year it is. We also started having this conversation with patients during point of care testing, especially those COVID testing symptoms, where when we were testing last year, we would have that conversation of, are you looking to get vaccinated against the flu? We know that you're aware of what viruses are. I think everyone understands the impact of viruses after the pandemic. And now people are a little less hesitant or a little bit more aware of why immunization and vaccination is so important to their health outcomes as well as their day-to-day health. We also have this conversation on medication reviews, especially with those individuals who are a little bit more complicated, who either have an immunological condition or who are complex diabetics, who puts them at a higher risk of complications if they do happen to catch the flu. And we actually have advertising on our cough and cold aisles during the season to make sure that individuals who are looking for symptom management, perhaps you don't have the flu, you have the cold at the moment, or perhaps you're buying allergy medication, it's still important that you have that protection against the flu for the season so that they should sign up for the flu vaccination. So I know it's a little early right now, but we often start thinking about our marketing as well as thinking about our team structure on how to have the talking points for this around this time in August. And then what we usually do is as patients come in, we have a reminder campaign that goes on where we're able to either note down their information. Some people still do it manually, some people do it digitally. And then we send out an email to them with their consent, if they've approved that, to be able to get the vaccine when it is available and ready at our store. So I thought I'd take this opportunity to kind of take a knowledge check question. And it's not necessarily knowledge, but to understand what you feel some of the most common challenges you face in offering a flu vaccine to patients are. What of the 4 listed here do you think is the biggest hurdle for you to overcome?
Results are coming in just now, Pam, just to let you know. The one that seems to be in the lead currently is vaccine misinformation, with about 70% of respondents picking that one.
Perfect. And I think everyone can tell I'm currently working at a pharmacy as my phone is ringing in the background. But I'll give it a few more minutes to understand what kind of challenges you guys face when you're offering a flu vaccine to patients. And I'd like to take a few minutes to kind of address some of those concerns, so to see how we can overcome them.
Perfect. Yeah, and just as a quick update, yeah, vaccine misinformation is coming in still close to 70%. And then the next one up would be time and workflow, coming in at about 24% right now.
Perfect. And I think probably most people have voted, so maybe we'll close the poll. Perfect. So it seems like vaccine misinformation seems to be the lead when it comes to the vaccines challenges that we have when offering the flu vaccine. And I think the biggest thing that you can do in overcoming the challenge of vaccine misinformation is coming forward with facts. I think it's hard for patients to fully understand what vaccines are because it's often portrayed to them in a very technical and clinical perspective. And I think for us as pharmacists and healthcare providers, one of our greatest skills is having that conversation with patients in a more lay and down to earth approach. I think one of the biggest things that I've seen work for me is when patients come in with vaccine misinformation, as I think the last one that I heard last year was, I've gotten the COVID-19 vaccine, I'm pretty sure that'll protect me against everything, is really highlighting what is a vaccine. So having that conversation with them and explaining that vaccines are not a silver bullet that can cure all. Vaccines are specific to their specific conditions. And it's important for us to understand that how a vaccine is made and the purpose of it being made is what it protects against. And I think I had a very long conversation with one of my patients in vaccine misinformation in explaining that why the flu is so important. A lot of people understand why they want to get vaccinated for COVID-19, whether that be that they understand the purpose of the vaccine or it's a requirement for them to do their day-to-day jobs, but people aren't fully aware of why it's important for the flu. And I think the biggest thing that has helped us in kind of getting that awareness out is expressing the burden. I mean, of all Canadians, 3,500 individuals have died from having the influenza virus. I think that resonates with a lot of people in understanding that it's not something to be taken lightly. And why would you take the risk if you didn't have to? Really understanding that it's one shot for the year that'll protect you for the season. And it's better to have that protection than not has really helped. The other component that was mentioned was time and workflow. I think we're all in a similar boat for that one, where it's hard for us to make the time, especially in a busy pharmacy practice nowadays, to have long conversations. What we've started to do is kind of go back to that component of it's a team approach. We've really had our pharmacy assistants, our pharmacy technicians support us in helping understand what we can do and share from the workload. So when it comes to some of the misinformation that we have on vaccines or patients have on vaccines, we've actually created small fact sheets that we're able to provide to patients to read so they understand while they're waiting for their prescription, so that when they get to the counter to pick up, when we're counseling, we'll kind of refer back to that sheet as well as explain a little further why it's important. We also have efficacy and safety data that's readily available that sometimes a lot of patients come in with questions as, I've heard that getting vaccinated will have this consequence or it'll have this outcome, or it's negative if you're of childbearing age, or they have a lot of misinformation out there. So we usually have those tidbits readily available so that not necessarily clinically can all members speak to it, but they can read off the kind of fact sheet and then have them come to the pharmacist and have a more in-depth conversation with them. The other thing that we've started to do is utilize our staff members who are more patient facing. So depending on how your pharmacy is structured, you might see that your pharmacy assistant is always taking in the prescriptions that drop off, or they're the ones who are scanning out scripts at the point of sale area. So in these areas, when they start having those conversations of, it's flu season, have you thought about getting your flu vaccine, is usually what we go to with our go-to question. We've started to change the way our staff talk from closed-ended questions to open-ended questions, and also recognizing a closed patient from an open patient. So if we go back to our case study, we can take a look at Tanya, and Tanya's come in to ask about her COVID-19 shot. We can assume that she has less hesitancy than an individual who's completely adverse to needles, or who's completely has misinformation on what vaccines are. So we've started to ask open-ended questions for those individuals to probe as well as understand where their fears are. Some of the most common things that we've come out that our patients have told us is hesitancy from pain of needles. So whether it's they've had the experience from another healthcare provider who's perhaps given them a needle that maybe was a little bit more painful. We all know the quicker, the less painful it can be, or perhaps it was just they're a bit more sensitive. We've talked to them about ways to overcome that hesitancy. We've taken a look at local anesthetic that you can put on. So it could be a lidocaine that you put on the area about 15 to 20 minutes, depending on the product. We've taken a look at making sure that they have medication prior to the injection. So perhaps they take a Tylenol or they take an NSAID. We make sure that the needle length is appropriate to them as well, because we know that the longer the needle, it's recommended that it's 1 to 1.5 inches for an IM injection for an adult. We want to make sure it's within that. We also, when we're looking at children, we've taken kind of a distractions approach to the sitting area. We've put in a TV for them to watch, as well as we try to avoid booking children right after each other to make sure that one doesn't hear one crying and the next one doesn't want to do it. We also have started training our pharmacy students or pharmacy interns who have come in to support us during the season in making sure they follow specific injection technique. We want to make sure that they landmark every time, because especially if you're new to giving injections, this can help with removing the pain. We also want to make sure that a lot of times I've seen in practice, sometimes people will stand and give the injection. It's better that you're at the same level as the patient. If you're both standing, that works. Otherwise, you should both be sitting to make sure that the needle goes in directly horizontal rather at an angle, which can be more painful. We also try to train our interns before they start injecting on individuals on either an orange or a stress ball to make sure that that technique is as quickly as possible, but also methodical to make sure that they aren't rushing it and it does go in properly. And the other thing we often try to do with our patients before we inject, for those who are hesitant and who have issues with needle pain, is have them relax the muscle. And it's never as easy to just say, please relax your arm, because no one will do that. It's more of trying to distract them. And I try to wipe the area, have a conversation, and just during that conversation, have that injection go through so that the muscle is relaxed and they're not thinking about or anticipating the pain that is coming forward. When it comes to time and workflow for staffing, we have created a system, and we try to ensure that if there are injections that are needed, we have an appointment booking system for those that allow appointment booking, where we have a bit of overlap during that time. We do have a certified pharmacy technician that did come in last year to support with that as well. We utilize students and interns, as I think most of you probably do. And what we do during the flu season is we try to have a little bit more support staff, but we also try for our team huddles prior to the shift, try to make sure we have a game plan in terms of if someone comes in who's a walk-in who needs an immunization or a vaccine for the flu, that we make sure that if the pharmacist is away, that the assistant is able to kind of arrange, pharmacy assistant is able to arrange the tasks so that it's still moving and it's not a full bottleneck, and that those tasks around it can still be done. So we've tried as much as possible to restructure our staff and skills to be able to allow for, it's not fully available to have overlap all the time, but enough support so there aren't those bottlenecks that occur during the day-to-day work of a pharmacy. So I think when we go back to our case study, and Tanya, we've talked about kind of having those open questions, specifying the importance of the flu vaccine, we want to make sure that we understand Tanya's concerns, and we want to review all the options that are available to Tanya. I know I touched on this a little bit on asking those open-ended questions, and I think most of us tend to go with closed-ended questions where we tend to ask, have you thought about getting the flu vaccine, where it's really a yes or no answer. But we really want to change what we're asking to a different method of thinking. So rather than saying, would you like a flu shot or have you considered getting it, we're trying to change the dialogue to what do you think about getting your flu shot? And that's really not a yes or no question. You've got to either say, I think it's a good idea, or I think it's bad because. So it allows the patient to kind of give you their rationale or kind of depict what the misinformation they have already is. And here are just a few examples of kind of open and closed-ended questions that you might see at the pharmacy. You really see, I mean, I've used these before I tried to kind of change that open-ended question mindset on, have you had a flu shot before? Yes or no, rather than asking, what is your last immunization, where it forces them to talk about, oh, well, I didn't have one because I dislike needles. So it kind of gives you that opportunity to probe. And it doesn't necessarily, again, have to be the pharmacist. It could be your staff or a champion in your store that kind of does these questions when a patient walks in to drop off their script. But it's really helped us engage in that dialogue and help overcome the challenges of hesitancy with a lot of our patients. So getting back onto the topic of influenza, I did want to highlight specifically that the new NACI statement on influenza for the 2022-2023 year, it does highlight the fact that the recombinant influenza viral vaccine is basically identified as to be the first and to date the only recombinant influenza vaccine available that's licensed in Canada. It is based on a review of available pre-licensure and post-market clinical data. So it has had a lot of study done about it and surveillance data, and it has been shown to have great efficacy for those individuals who are 18 years and older. So again, it kind of falls into that plate of adults, and as I was talking about before, adults who are in that working area who often don't necessarily think about helping themselves because they're caregivers for someone else, whether it's older or younger, and they don't recognize the importance of protecting themselves against the flu. Specifically about the recombinant influenza vaccine, it's demonstrated 30% relative vaccine efficacy against lab-confirmed influenza illnesses in those individuals older than 50 years as well. So it's not only recommended for those individuals who are 18 plus as it is, but it's shown a special effectiveness in those individuals who are 50 years and older. And you can see that specifically here that with the recombinant influenza vaccine, the attack rate is substantially less in the laboratory confirmed influenza cases. So it's an issue of 3.2% versus 2.2%, which is a very large value. So it's 30% lower when you use a recombinant influenza vaccine as opposed to the standard influenza vaccine. So this really shows the efficacy and the protection that this specific vaccine offers individuals. You also see that for NACI, the seasonal influenza statement for 2022 and 2023 clearly highlights specifically that it is potentially better than the standard influenza vaccine, and it is expected broader protection against influenza B strain that is not seen specifically in the standard trivalent vaccine. So there is a lot to be said about the clinical efficacy of the recombinant influenza vaccine and the importance it plays in when considering the different types of vaccines that are available to our patients. So just a little bit more on the vaccine to understand its place. It really shows here is that where it falls, the fact that it eliminates viral mutations in manufacturing process, especially when you're using that egg process rather than the recombinant process. There is a larger chance that it is a closer match to what the WHO identifies as a strain that will be circulating for that year. We do know that it's indicated for individuals who are 18 plus. We recognize that it is also especially recommended for those who are at higher risk. So those who have chronic disease, who are pregnant women and healthcare workers. And we also recognize that for those who are older, it also has an efficacy to play, that it has been shown to be 30% more efficacious when compared to standard dose quadrivalent vaccine. So there's a lot of protection to be said about this vaccine. So knowing all that, when we look at our case study of Tanya, we know she was 58 years old. We know that she had a number of different comorbidities. What would we want to recommend to her? What would we want to do next for her? Do we have a couple different considerations to make. Do we go with quadrivalent vaccine versus a trivalent vaccine? Once we decide on that, do we want to go to a recombinant influenza vaccine versus the standard quadrivalent vaccine? What do you feel you would be comfortable in recommending for Tanya? And again, it's taking a look at what you feel based on what you know about Tanya would be your recommendation. So I'll just wait a few minutes here to kind of give everyone a chance to go through the poll.
Yeah, we're just getting a few responses in right now. We're coming in at about 80% item C, recombinant quadrivalent flu vaccine, and about 20% are responding high dose flu vaccine.
Perfect. And I think, should we give it a few more seconds before we close, or do we feel like that's probably most people who've given their opinion?
Yeah, we're on about 60% participation on this question, and it's coming in at about 80% are selecting item C.
Perfect. So I guess we can close that poll now. Really from this knowledge check, it's just to gain kind of your perspective on what you feel would be the ideal recommendation for Tanya, or based on what you've seen her current condition is. I mean, both the recombinant quadrivalent flu vaccine and the high dose flu vaccine have something to say here. C is probably the easier choice in the sense that the recombinant flu vaccine, quadrivalent flu vaccine, holds a lot of what Tanya needs. It's more specific to the strain. It's specifically indicated, it's shown 30% more efficacy against the standard quadrivalent vaccine for those who are older than 50, and also for those who are at high risk, like she is, with comorbidities. High dose flu vaccine is a choice as well, but I think we've all seen in practice, it's traditionally meant for seniors who are 65 plus, so supply might be limited. So in that sense, C and D both have options here, but C might be more realistic based on what you see from logistics and availability in your pharmacy. So other considerations that you may have done when trying to determine what Tanya would be best suited to is, what is the patient's age, the patient's medical conditions, their allergies. The patient coverage is another condition as well. Not everything is provincially covered, and for those that are not covered, sometimes coverage is something you want to think about as to if they are within a certain age range they might be working in. Sometimes vaccinations are covered by people's individual private drug plans. So that's some consideration. And also you always want to make sure that depending on the population you see come into your pharmacy, you try to optimize the use of the supply that you have on hand. So with that, I know we're running a little slow, but I wanted to make sure I got one more case study in before we ended. I want to talk about Raj, and Raj is a little bit different than Tanya. Tanya is an older individual that we saw and may typically see in your pharmacy as a return patient and as a patient. For Raj, he's coming to your pharmacy for the first time. He's a lot younger. He's 28 years old. He's got no known medical conditions. In speaking to Raj that he mentions that he's allergic to eggs. And really the reason he's in the pharmacy today talking to you is that he's looking for some sort of cold medication. He's got a bit of a stuffy nose. He's got a bit of a headache. He believes he feels something's coming up and he wants to manage his symptoms and control it as best as possible. So he's really looking to you for your guidance, but he's not a usual patient at your pharmacy. So the two main things that you note that he mentions to you is, one, his allergy to eggs that you want to keep in mind. And two is that he wants something easy. And when you have that conversation about, okay, you're having these symptoms, did you get your flu vaccine this year? He says no, because he has hesitancy, because he doesn't like the pain of needles. And, he had his vaccine a couple years ago, and since then he's never done it because he had a horrible experience. So when we look at Raj, these are some of the things that we often come to mind. He's come in for symptom management. And we know that when we look at symptom management, people get symptoms every year, and a lot of the symptoms that you see with the flu or influenza can be similar to those with other respiratory conditions, such as the cold or COVID-19. So it's important that we understand that the influenza or flu virus really is something that Rod should protect himself against, because one, it's hard to differentiate from a symptom perspective when you're looking at COVID-19 versus influenza. And as well, you also want to make sure that you're protecting yourself so you understand when you're symptom managing, it is truly the cold that you're managing your symptoms for and you're taking medication for, rather than if you happen to have the flu and you let it progress and get worse. So Raj has a lot to think about. With restrictions to entry with work with COVID-19, he wants to make sure that, okay, if I can't go into work because I have symptoms, and perhaps he's in a profession where having a negative rapid test doesn't necessarily allow him to come back to work, it could have impact on his pay. Raj also wants to make sure that he understands the burden of influenza. It could have serious complications for him or for the loved ones that he lives with, because perhaps he lives with someone who's a lot older. And so if he does have the flu and unknowingly spreads that, for those individuals, it could be a lot serious. So he really wants to understand what the benefits are of having him vaccinated against the flu and what that importance plays for him. The impact annually in the Canadian health system is just a sidebar that I wanted to talk about, and understanding the burden of influenza. I mean, to Raj, he understands his health outcomes as well as his family members may be impacted if he doesn't get vaccinated and he happens to spread the flu. But influenza is estimated to potentially cause 2.5 million symptomatic cases of illnesses annually in Canada. So that's quite a lot. And that's to say that that number of individuals will have symptoms in that in a year in the Canadian population. And I think the Canadian population right now ranges around 37.8 million or so. So it's quite significant. It also causes 175,000 emergency department visits. So as we see, our emergency department is already at strain from COVID-19. We recognize that there's a lot of burden already on the healthcare system. And we know that we're just recovering from that. And there's still a lot that's going on. So something we want to prevent and is often underappreciated. As mentioned before, influenza results in about 12,000 or 12,200 hospitalizations every year and 3,500 deaths each year. So it's really astounding to think about what type of an impact and burden influenza has. And perhaps this kind of resonates with Raj, and understanding that if this number of individuals have influenza symptoms and that he happens to be one of those, that's time he's missing from work. And if he happens to be a contract individual, that could have a huge impact on them. So Raj really talks to you and understands that, okay, the vaccine may be something that he wants to get, but he hates needles. He really does not want to have a needle if possible. So in Raj's case, what would you consider for him? Do you feel that Raj would benefit from having a numbing agent? Do you feel that Raj would benefit from having a 0.5-inch needle rather than a 1 to 1.5-inch needle? Would he benefit from having an intranasal quadrivalent vaccine rather than a regular vaccine, a standard quadrivalent vaccine? Or would he benefit from a high-dose flu vaccine just because he wants to protect himself a little bit more? So there's no, sorry, go ahead.
Sorry, I was just going to say some answers are coming in right now. We're getting about 53% on numbing agent and 40% on intranasal.
Perfect. I think I'll kind of just close this poll because this one's more of what you would consider. I think there were some clear wrong answers. B was definitely wrong. You never want to go with a smaller needle just because someone's afraid of that. But you are right. Both a numbing agent or an intranasal quadrivalent vaccine are options. Usually we tend to go with a numbing agent if possible, just because the intranasal quadrivalent vaccines are sometimes a little bit harder to get a hold of. And still the intranasal quadrivalent vaccines, though they are shown to be less reactive with individuals who have an egg allergy, there is still a slight chance of that allergy to occur because there is egg incorporated into that. So really, if we wanted to go with the numbing agent for Raj, there's a number of different options that would work for him. So if we investigate his allergy a little further to understand, okay, was it true anaphylaxis or did you just happen to have a stomach ache? Like what told you that you had this egg allergy? And Raj explains to us that it's a true allergy. You want him, he explains that it's kind of been something that's been on his mind. He knows he should get vaccinated. He wants to. An option for Raj in this circumstance would be the recombinant influenza vaccine. For him, that would be best fit with a numbing agent. And of course, because he has an allergy, it's always important that Raj has an EpiPen on hand, and you go through the injection technique standards to make sure Raj is relaxed. You make sure that you have landmarked, you try to distract, and those are some of the things that you can do for Raj to help him feel a bit more comfortable as he gets vaccinated. So as we talk about Raj and getting vaccinated, and I know there were a couple of different choices we could do, one of the other things that we have to keep into mind is what vaccine is covered and being covered provincially versus privately. So Raj is younger, perhaps he's employed, perhaps he has private insurance, perhaps that insurance covers vaccines, some do, and in that case, he may have a larger number of vaccines that he can choose from. It's definitely important to have that dialogue with our patients so that they can either call their insurer or we can try to test both to see if coverage is available for certain vaccines. Again, vaccines that can be provided for us need to be by the Universal Influenza Immunization Program. For those that are covered under the Universal Influenza Immunization Program, it's not always covered for every age, so it's important that we take that into note and make sure that if the coverage is not available, do we use it through private insurance or not? Specifically for Raj in this circumstance, we recognize that he had two different options and either of those options would work, but it's important that we pick the option that best met his needs. And again, just kind of looking back at as influenza as a contributor to abrupt absenteeism and lost productivity. Absenteeism is something that we don't often think about or really talk to our patients about. But in the case of Raj, really highlighting the fact that perhaps he is a contract worker or he works on an hourly wage, the loss of days could really impact his day-to-day living. So in a 2008 review, it was identified that individuals who happen to have influenza or the flu lost a number of days on average per case. So it ranged to about 1 to 4.5 days that people personally recognized. For those who had a severe enough case where they had confirmation from the lab, ranged from 1.5 to 4.9, and physician confirmed cases range from 3.7 to 5.9 days. So really there's a potential for an entire week's salary lost for Raj, and abrupt absenteeism and loss of productivity, if he does go in presenteeism, can lead to poor performance indicators from employers that can kind of potentially, if Raj is on probation, may incur him losing his job or other issues. So some other interesting facts in the Canadian Labor Force survey that was identified is that 20 workdays lost per 100 full-time employees annually due to the influenza were noted, and 12% of employees take time off of work due to seasonal influenza. And these were kind of older studies that were identified, but they still hold true right now. And I think people are even more cognizant to it now, especially with COVID-19 and the impact that's had on our day-to-day kind of labor force and who calls in sick when and how they show up to work. So a couple of things that we can review with Raj is understanding what his healthcare spending account is like. Do we need a prescription? What is required for Raj? His insurance plan design, does it include various vaccine? And is there an exception process? We can review his overall benefits, or if he's going with something that's publicly funded, to really see what his options are and where Raj falls. And finally, I think I have like 2 minutes left. I did want to kind of end with this slide on the broader impact of influenza, because influenza is more than just a flu. It's more than a sniffling nose and having a temperature. It can have a lot of permeated impacts on other conditions that you see. And I think some of the most interesting ones that I kind of noticed are the fact that there's so much impact on blood sugar. And I think diabetic and weight management is something we see a lot in pharmacy right now, especially for those patients. They're not always seen or haven't been seen by their family physician as often as they previously were. And that's an area that they should really be cognizant of. Again, it also impacts cardiovascular complications and renal complications as well. So really, over this presentation, I hope each and every one of you were able to take away that pharmacy is the primary provider of influenza vaccine in our landscape. We have a role to play, and not just us as pharmacists, but all team members play a role in offering the flu shots to make sure that all team members are comfortable in having that dialogue with patients. The influenza vaccination reduces the risk of severe outcomes and helps protect those who are most vulnerable, may not be the patient themselves, but if they are a caregiver, those around them. And to understand that the recombinant influenza vaccine is a new option for adults who are 18 plus in the Canadian market, and to help them reduce the risk of influenza because it has been shown to have efficacy and is closer to the strain that WHO determines to be the strain that is circulating. And with that, that is the end of my presentation.
Well, that was great, Pav. Thank you so very, very much. We did actually have one question that came in on the Q&A. Are there any studies on RIV versus quadrivalent, or sorry, versus high dose, as they hardly use trivalent anymore?
Yes, there are studies with recombinant influenza vaccine with standard quadrivalent. High dose, I'll have to investigate. But if the individual did want to send an email to you guys, I can send that forward to them with those studies that are available.
Perfect. Yes. So if you could just send an email to education@opatoday.com, we can get that answer to you. And we also got one more question that came in. It said, just confirming that Supemtec can be given to patients with an egg allergy.
Correct. Yes, that's right.
Perfect. And if there are no more further questions, I do want to say thank you so much, Pav, for taking time out of a busy day in the dispensary to join us today and present. And I also do want to thank Sanofi for supporting and sponsoring this webinar today.
Thanks, John. And thanks everyone for listening. And thank you for putting up with the calls on the phone.
I think it's something we're all used to in the pharmacy business. So thanks again, Pav. Have a wonderful day.
Thanks.
Take care, everyone.
Bye, everyone.
Bye.